and Ear. We are so happy that you can join us for this tour. Let's go inside. This is our emergency room. We are here 24/7, ready to receive any type of eye problems. We can get any type of eye pathology here, which is really good as a resident. We get a very good experience here because we see like neuro-ophthalmology cases, retina cases, and we can also do some minor procedures if needed, like lid laceration repairs. We have a good support here also from our fellows and from our hospitalists. So in our emergency room, we also have a very useful emergency procedures room. Here we do mostly 3 different types of procedures. First of all, we can repair any eyelid lacerations, either marginal, canalicular, any type of eyelid lacerations with our oculoplastics fellows. We also do here intravitreal injections of antibiotics with our retina fellows. We can do a procedure called a cryopneumatic, so it's a very useful room. Another unique thing of Mass Eye and Ear is that if at any point we need an urgent CT or MRI, we can get it right here, which is like steps away from our emergency room, so very convenient for our patients and also for us because we can easily discuss the results with our amazing radiology staff. So this is our first floor. We spend a lot of time here because we have here both our cornea, glaucoma, comprehensive ophthalmology, and also uveitis services, and of course our very own trauma and continuity clinic. Here we see different types of pathology. Most commonly we see the post-ops of our open globes that we operate on, but also other cases that we operate on, such as like dense white cataracts or pterygiums or chalazions. This is where the magic happens. Welcome to the 3rd floor. We spend a lot of time here because, as you will see, not only we have most of our lectures on this floor, but also we have the library, the residence lounge, and also our wet lab. Also, I want to show you that on these walls we have some paintings of some of the giants in ophthalmology. Some of them still working here and from who we are still learning from.
This is the wet lab area. It's open 24/7 and accessible anytime you want. It's actually one of the largest wet labs in the country. We have 9 different stations here, as well as an IC simulator, phaco machines, as well as vitrectomy machines, and you have pretty much every tool, instrument you need. There's pig eyes accessible. You don't need to order them in advance. You can just come in and grab one. It's a great place whenever you have downtime to come and practice your skills for both residents and fellows.
On the 3rd floor, we also have our call rooms. This is a very comfortable place that is dedicated just for ophthalmology residents, where we can get some rest overnight, either if we are doing nights here in the emergency room or if we are on call. Now, here we have the Sloan teaching room. In Sloan, we have our chief rounds and also our Friday morning lectures, and also any other smaller educational events that happen here instead of Meltzer Auditorium. And while we are here, I also want to walk with you to the Path Lab. So our Path Lab is where we spend some time during our junior year, our 1st year. We get to learn directly from Dr. Jakobiek, Dr. Dryja, and the new director of pathology, Dr. Stagner. With them, we review the path slides from cases that we get here at Mass Eye and Ear, and also some consults that we get from other institutions. It's really a unique opportunity for us to see rare pathology and to learn about ocular pathology in general. Now we are at the Meltzer Auditorium. Here is where we have our weekly grand rounds. We also have lectures, conferences, and also lectures from visiting professors. Here is where we learn from some of the most well-known and well-respected ophthalmologists, not only from the country, but also from all over the world. The library is also a very special place at Mass Eye and Ear. Here we count with the support of 2 dedicated librarians that can help you with anything that you think about and you need. Either if you are preparing a case for grand rounds or you are working on a research project, they definitely will find a way of finding all the papers that you need to make it happen. Additionally, in this library, we also have a collection of unique, rare books, the oldest one dated from 1490, and believe it or not, actually this place has been listed as one of the places to not miss if you are visiting Boston. I would like to show you our awesome residence lounge. This lounge was very recently renewed. You can see that it looks super modern. In one of the rooms, we have our lockers where we can store our personal belongings. And we also have a fridge and a microwave. So basically, we can just bring our lunch and eat here with our co-residents and friends. I think it's a very nice and welcoming space. We are the ophthalmology department of Mass General Hospital, also known as MGH. So whenever we have consults, either they come to Mass Eye and Ear or we can just go directly there through this bridge that connects Mass Eye and Ear to MGH. So now we are on the 6th floor. On the 6th floor is where we have most of our OR suites, and we do get to spend a lot of our time as residents. Here we do a lot of cases and a huge variety of cases. Not only cataract surgeries as primary surgeons, but also we help in retina cases, glaucoma cases, corneas, strabismus, among everything else that you can think about in terms of eye surgeries. Importantly, in these OR suites, all the staff is 100% dedicated to ophthalmology, which means that the scrub techs and the nurses, all they do is to help us in these cases. So everything runs so smoothly that it's really a pleasure to learn here and to work here every day. This is one of our 2 surgical floors. Here is where ENT does most of their cases. For us, ophthalmology, in these ORs, we do most of our oculoplastics cases. Additionally, when we have our amazing vitrectomy and cataract surgery courses, this is where the magic happens. Welcome to our neuro-ophthalmology clinic, where we spend time both in our first year and second year of residency. Here we have the great opportunity of learning with faculty that was originally trained both in ophthalmology and in neurology. This means that we really get a great exposure to different ways of thinking and dealing with these complex and challenging cases. Now we are at our amazing cafeteria. This is where we usually come if we want to grab a snack or also for lunch. Actually, for lunch is great because most faculty also comes here for lunch, which means that we have a great opportunity to have some informal FaceTime with them and discuss whatever topics we feel like. Additionally, as you can see, we have here probably the best view of the hospital, and even though I can sound a little biased, I think this is likely one of the best views of Boston, and yes, you get it from our cafeteria. And now we are in our inpatient unit. This is shared between ophthalmology and ENT. Whenever we need to admit a patient, for example, for an open globe, this is where they stay. And you can see again that here we also have an awesome view. Mass Eye and Ear has a large retina faculty of world-renowned specialists in medical retina and surgical retina. And because of that, actually, we have an entire floor just dedicated to retina and ophthalmic imaging, which is where we are right now. It has been just renewed, so you can see everything looks brand new and amazing. And we have the most updated equipment that is very useful not only for clinical care, but also for research. And with this, we finish our virtual tour. Thank you all so much for joining me. I wish you all the best for your interviews, and I'm really looking forward to welcoming you here as a co-resident and also as a friend. All the best!